Mhm.
I thought I'd switch onto your oncology product, Gedeptin, and you announced, I think, in the last quarter or so, that you're going to and move into other solid tumors. Right now, you're into squamous cell head and neck cancer, I believe.
Yes.
And just for the viewers, as a reminder, Gedeptin is a gene-directed enzyme Prodrug therapy, which is a type of targeted chemotherapy and gene therapy combination. So, what tumors are you anticipating expanding into, and what's the evidence that you have that showed you that was the place to go?
We have sponsored and supported preclinical work done on some very good, animal models and all that has shown consistently that when you combine Gedeptin with an immune checkpoint inhibitor, you end up enhancing the consistency across various solid tumor, if you take different examples, populations, and you of the performance and consistency of performance of the immune checkpoint inhibitor. And so the initial target we have, which we're preparing everything, I mentioned this recently. Our number one rate limiting step is the manufacturing process. We're manufacturing your new batches of product, and we anticipate towards the end of 2026 we'll be rolling out that phase 2 trial, which will be first line head and neck cancer, and we're following the Keynote 689 study that resulted in Merck receiving a new indication. If I'm not mistaken, in that data, they showed about a 10% response rate. We're seeing about twice that level in the animal data that we're witnessing. So we're looking at triple negative breast cancer, pancreatic cancer, and other. We haven't defined, so what I'm saying are ones we have been looking at that we're discussing with our oncology advisors, but we haven't settled on the specific ones outside of the first line head and neck cancer. And the reason why is not that there are arguments about that, but it's all about resource utilization and planning and what we think would make most sense. I will say that while we were in Europe attending Bio Europe, the fall meeting, which is more of a partnering meeting and less so, it's not specific to vaccines. It's a general bio partnering meeting. We had numerous discussions with participants in the space of immune checkpoint inhibitors, current players as forthcoming players, and there's quite a what we're seeing is the greatest interest we've seen to date for discussions related to Gedeptin in some form of collaboration with such players and all. These discussions are going to carry over into January when we're in San Francisco participating in JP Morgan and Biotech Showcase.